Euthanasia is a highly controversial issue that has caused many debates over previous decades, defined as the painless killing of a patient suffering from an incurable and painful disease or in an irreversible coma. Euthanasia is currently legal in several countries in Europe, such as the Netherlands, Belgium, and Switzerland. However, euthanasia is currently not legal and not practiced in Australia. The article written by Steele and Worswick regarding Australian legal regulation around international travel to end life identifies the various aspects of euthanasia, looking in depth into physician-assisted suicide, familial and carer-assisted killing, and travelling abroad to die.
The ethical side of physician-assisted suicide is often questioned, as these professionals are there to help you get better rather than authorising drugs that will kill the patient. This situation is known as the doctrine of double effect. It shows that a practitioner allowing high doses of painkillers to a patient is absolved of the bad effect, being death, because it is a side effect of the desired outcome, being pain relief. However, under the Hippocratic Oath, physicians' aim is to do no harm, and assisting someone's death is considered doing harm. In the United States, New Zealand, and the United Kingdom, where a medical practitioner increases the doses of painkillers with the intention of pain relief and death results, this is a valid defence to a charge of murder, as death wasn't the intent. However, in Australia, there is no common law surrounding this issue, as there has been no cases to go by. As practitioners now are at greater potential criminal liability, patients will find that their practitioners are less likely to accommodate their wishes to end their life and will turn more to their family and friends to take their wishes seriously.
Legalising euthanasia introduces an array of issues. However, the topic, which is regularly touched on by doctors, governments, and individuals, presents such a deep pool of concerns and issues that no case is alike. Steele and Worswick highlight the issues regarding equal and fair justice for those willing to end their lives and often for those who assist a patient in ending their life. These cases, often dubbed mercy killings, have varying results which, when presented in a court of law. Often mercy killings are acted out by family members or friends with the consent and will of the patient. In many situations, it is difficult to determine the reality behind the individual's circumstance. However, coming under prosecution, the outcome is widely varied. Family members can have varying influence in the euthanasia process. Kimsma and Lewin explore the 5 main roles family members can have in euthanasia that form ethical and legal concerns, including aspects such as families initiating a request to help the patient die without the acknowledgement of said patient, and can also remind a physician of their duty to keep a patient alive and to provide care to dissuade euthanasia. On another hand, family members who seem too eager for euthanasia to be formed trigger concerns as to what may be gained. Physicians and professionals are required to raise these concerns in countries which have legalised euthanasia. Media attention and continued interest regarding one's control at the end of life have generated copious debates and serious consideration regarding the legalisation of such practice in Australia. Many Australians believe that with the right to life comes the right to a dignified death. Euthanasia allows a patient to exercise their right to a dignified and pain-free death.
In the last 2 decades, the scope of Australians travelling overseas seeking assisted suicide from countries which offer it has considerably grown. This could be attributed to increased media coverage in the topic of euthanasia as public interest grows, with anecdotal cases becoming more prevalent. Countries which offer euthanasia, as mentioned previously, all but refuse to help those who are not residents of that nation, except for Switzerland. Currently, there is only one clinic entitled Dignitas assists foreigners in choosing to end their life on their own basis of terminal illness. However, patients seeking treatment must meet a strict set of criteria, including an in-depth medical report and psychiatric analysis. Whilst legal in Switzerland, the majority of euthanized patients are primarily foreigners. Over 50% of all euthanized patients in Dignitas were German between 1998 and 2011, and the Swiss only accounted for 1/10 of the people euthanized in the clinic. Moreover, 50 Australians held memberships in 2011, and between 1998 and 2011, 15 Australians chose to terminate their life at the clinic. Whilst many euthanasia advocates promote travelling overseas to terminate life, others promote the idea of self-euthanizing from home. One of these advocates, Dr. Philip Nitschke, promotes the drug Nembutal should be available for people who choose to end their lives. Nembutal is a drug currently used in veterinary practices to euthanize animals. The peaceful pill, as Nitschke promotes it, is currently illegal for persons to possess outside of veterinary practice. However, in the previous decade, 51 people have died from an overdose from the drug. 8 of these cases were purchased from overseas. It is evident from these statistics that despite the illegal status of these drugs, people seeking assisted suicide will persist in trying to obtain these drugs with the final goal of committing suicide.
The main idea due to this increase would be patients prioritising and thinking about their quality of life during or after a disease over extending their life. Factors such as poor quality of health and loss of independence was the main contributing factor to these rates increasing. Such thoughts made the individual believe that it was their time to die, as well as the idea of living a pain-free life. In 76.5% of patients seeking euthanasia, this led to the Oregon research to identify a direct connection between pain, deterioration quality of life, and the desire to end one's life. Another contributing factor found was if the individual was aware that they were going to lack mobility due to obtaining a disease such as a motor neuron disease, as well as those who live with disabilities like quadriplegics. In Mr. Rosita's case, the issue was not one of the terminal illnesses, as he was a quadriplegic, but rather that he was a prisoner in his own body. Recent polls conducted in Australia found that 75% responded yes to the question if someone with a terminal illness should have a medical practitioner in assisting them to die. And 85% agreed that those who lived with a terminal illness and an incurable disease should be assisted to end their lives. In the Northern Territory, medical practitioners were asked on their views of euthanasia, and 174 of them agreed that this should be a legalised practice. Although Australia has not legalised euthanasia, it was found that medical practitioners have been involved in ending people's suffering as well as accelerating their death through other ways other than euthanasia. 36.2% reported that they had given drugs in greater doses than necessary to relieve symptoms and with intentions of hastening death. 20.4% reported that they had given drugs with the intention of hastening death but without the explicit request of the patient, and 1.9% reported assisting with suicide. Considering euthanasia is not legalised in Australia, there was found to be a considerably large rate of euthanasia use. A statistic showed that 4.2% reported having access to euthanasia. When speaking in terms of the medical ethics, we speak about the key principles and rights professional practitioners must obey when treating patients. Adopted by the American Medical Association, these principles are not to be considered as laws, although they are outlined and explain the behaviour a physician is to obey by. The American Medical Association states that these principles are to be followed as members of the profession. A physician must recognise responsibilities to patients first and foremost, as well as society, to other health professionals and to itself. The main principles of the medical ethics are autonomy, justice, beneficence, and non-maleficence. Autonomy mainly refers to the action in making a decision regarding healthcare producers. Patients are to be fully informed about the decisions they make, and all the information about the procedure is to be presented and provided by a professional practitioner. First off, autonomy. It is a part of our human rights that we have all control over making our own decisions, leading to control over our own bodies. Therefore, they have the right to make their own decisions on when they should end their own life through the use of euthanasia. Justice refers to the law of a fair society and equal treatment, which is to be shown to all patients by professional practitioners. There should be no presence of discrimination. Justice would refer to the equal use and distribution of euthanasia. If euthanasia was legalised in Australia, this means it would have to be available to all of society. There should be no presence of discrimination to anyone who chooses to use this practice. Beneficence is all for the patient and making sure that their choice of healthcare procedure is doing good to the patient's health. The principle of beneficence would be the choice of using euthanasia to relieve the individual from pain or suffering. In this case, doing more good than harm. For an individual to choose to end their life, it would mean that they are aware that they have lived with poor quality of health. And non-maleficence is somewhat similar to beneficence. Only difference is no harm is to come to the patient when undergoing a healthcare procedure. The only time euthanasia would go against non-maleficence is if it was used against the will of the individual. This is doing more harm than good to the patient. If the professional practitioner had all the control and choice over euthanasia, it could even be considered as murder, as the patient has not said whether or not they wanted to end their life or not. As you can see, euthanasia, being a major ethical issue, connects and draws from all of the above.
When discussing euthanasia, a major concern within the clinical setting is the issue of how the patient is euthanized. Currently, there are two ways of people being euthanized, both with different methods of how it is carried out. First is self-administration, and secondly is assisted administration. A primary issue with a person using a self-administration method is the risk of failure to euthanize themselves. If a person is unsure of dosages and lacks the medical knowledge to administer a lethal dose of either a drug or non-drug method, it could lead to a considerably larger amount of suffering instead of achieving the goal of ending that person's suffering.
3 forms of euthanasia are currently acknowledged in the medical world: voluntary euthanasia, non-voluntary euthanasia, and involuntary euthanasia. Voluntary exists as a physician with the consent of a patient performs euthanasia. This act is legal in few countries across the globe. Non-voluntary form is where the patient is unable to give consent, for example, child euthanasia. Lastly, involuntary occurs when euthanasia is performed against the patient's will. Under the circumstance that euthanasia should become legalised in Australia, a variety of professional situations can be expected, causing both advantages and dilemmas. While it is a physician's position to help the patient, and if euthanasia was legalised, it would be their position to, with reason, respect the will of the patient to die. This may cause some professional dilemmas in cases where the doctor does not believe in euthanasia due to personal and religious beliefs. The physician might attempt to dissuade the patient or refuse to look into the euthanasia. This breaches the individual's right to choice and decision making.
As personal opinions come into play, the concern of personal bias evolves. Whether it is a physician, patients, or the patient's family, the individual opinions of many should be considered. However, in the long run, the patient's needs and wants should be the first priority. Those who disagree with the legalisation of euthanasia have mentioned the slippery slope effect and appeal to the notion that the physicians must uphold an absolute repugnance to killing. The slippery slope arguments is explored as a notion that permitting voluntary euthanasia will lead to the support and legalisation of non-voluntary and involuntary euthanasia, which challenges the concerns of medical ethics. Once a professional has approved these legitimate reasons, there should be little dispute. Something as serious as euthanasia must not be misused by the individual or the professional practitioner. The patient should overrule the professional when it comes to such control. After all, great with power comes great responsibility. Who better to make responsible and to hold all the power than the individual? It is evident that as a group we stand by the legalisation of euthanasia. If it is justice to give every individual the rights to living their lives, then it should be just to give them their rights to death, and death with dignity. As long as euthanasia follows the principles of medical ethics, there should be little issues involved once legalised. Although without doubt, taking such a course of action should come with legitimate reasons such as health-related issues.